Hi, my name is Dr. Siddharth, and today I'm going to speak on the topic of interstitial lung disease. Interstitial lung disease is a group of disorders in which basically there is a progressive scarring of tissue, that is fibrosis, around the lung, and especially of the interstitium, that is in alveoli. Interstitium is present around the alveoli, in which fibrosis and scarring happens, due to which oxygen exchange is hampered and patient shortness of breath increases, and thus patient gets desaturated and he feels more shortness of breath and lands up into a breathing trouble, and that is why a patient has to refer to a doctor for finding out what is wrong with him. Common causes of interstitial lung disease are autoimmune diseases. Autoimmune diseases will be rheumatoid arthritis and scleroderma are the two examples of autoimmune lung diseases. Then occupational interstitial exposure also causes the development of artery. Like certain occupations will have exposure to chemicals or stone dust or fibers or other things, especially found in factory workers. So asbestosis and silica are one of the common examples of occupational hazards that leading to an ILD, and other things like molds, that is because of the fungus, and bird droppings that may also be associated with the ILD. So like in Delhi, there are many places have lot of pigeon droppings in their verandas or balconies. So if they are exposed on a long period of time through it, they will develop interstitial lung disease. Then medications. Certain medications may also promote development of interstitial lung disease. Most common are the chemotherapeutic drugs and antibiotics such as nitrofurantoin, and some of the anti-ablative drugs also can cause development of interstitial lung disease. Then idiopathic causes are in which the cause is not known, that is why we say it idiopathic, and thus patient might end up into development of ILD, and thus we have to treat him symptomatically and according to his lung functions. Then symptoms. What are the symptoms that cause interstitial lung disease? First is cough. Second is shortness of breath, especially on exertion. Then there is fatigue. Then weight loss, and then there is clubbing of fingers. What happens is the tip of the fingers becomes like a drum. Okay, so this part of the finger will become like a globe, rounded, and thus we call it clubbing. Like you have seen a drumstick, in which the distal part is very big and the proximal end is very small. So that is how it will be said. Then diagnosis. What are the diagnostic tools that we can use to diagnose this ILD? First is high resolution CT scans. This is the most important diagnostic tool for labeling a patient he is having ILD or not. Second is pulmonary function test. Pulmonary function test, simple pulmonary function test will not help in this. We have to do a diffusion lung study. So further talking about ILD, I will say there are the common types of ILD that are present are idiopathic pulmonary fibrosis, hypersensitivity pneumonitis, sarcoidosis, NSCIP, non-specific interstitial pneumonia, and cryptogenic organizing pneumonia. These are the few types of ILD. So diagnosis of ILD can be done by the common and most important tool for diagnosing ILD is HRCT chest. Other thing is pulmonary function test. Pulmonary function test pain will not be helpful on the whole. So we have to do a diffusion lung study, in which the oxygen transfer at the alveolar level is seen, and whether the blood is getting proper oxygen or not is calculated, and thus patient might be labeled as ILD. Then other blood tests like autoimmune diseases can be confirmed by blood tests like sarcoidosis, rheumatoid arthritis, scleroderma, and other kind of conditions can be done by doing a blood test. Then lung biopsies can be done. Lung biopsies are done by bronchoscopies, in which the tissue sample is obtained, and thus histopathological examination is done for diagnosing a patient of ILD. Then bronchoalveolar lavage also shows certain kind of things in which a patient can be the amounts of certain cells will also indicate that patient is having ILD or not. Then treatment first is corticosteroid and immunosuppressants are the major treatment forte in which is given to majority of the patients, and second is antifibrotic drugs. Then third thing is managing the patient with oxygen therapy. Other things like BiPAP or CPAP or ventilators can be used in certain amount of patient depending on the type of ILD that person is having. Then third is pulmonary rehabilitation, increasing their physical capabilities as many of the patient might be bedridden. तो उसके लिए हम उनको पल्मोनरी रिहैब करते हैं, उनकी एक्सरसाइज कैपेबिलिटी को बढ़ाते हैं और पेशेंट को हम मोटिवेट करते हैं कि ही शुड गेट आउट ऑफ बेड एंड दस डू certain exercises that he will increase his pulmonary compliance. And then the last part, in advanced ILDs we can also suggest for lung transplant. Many of the patients have to be checked for fitness and all, and proper donor match has to be done, which is a very tedious process, and thus very few people can go up for this treatment. It is very expensive also. So do go to your doctor, get all the things checked, and thus see that you are suffering from ILD or not, and thus get the treatment done. Thank you, Dr. Siddharth.